Hello and welcome to Unit 2 of this module on disease outbreak response. In this second unit of the module, we'll be looking at investigating and responding to an outbreak. So an outbreak or epidemic is an increase in the number of cases of a disease or an event above what is normally expected in that population in a given area over a particular period of time. A cluster is an aggregation of cases or health-related conditions in a given area over a particular period, regardless of whether the number of cases is more than expected in relation to time or place or both. The purpose of investigating an outbreak is to verify the outbreak and identify the source of infection or cause of the public health event, and to collect information and laboratory specimens for confirmation, to identify and treat additional cases that have not been reported or recognized, to describe the epidemiological situation in time, place, and person, to select appropriate response activities to control the outbreak, and to comply with the International Health Regulations 2005 of the World Health Organization. So here we see the steps of an outbreak investigation and response. And these include establishing the existence of an outbreak, preparing for field work, confirming and verifying the diagnosis, defining the case and searching for additional cases, analyzing data and generating hypotheses, testing and refining hypotheses with analytic studies, implementing control measures, writing reports and disseminating the findings, conducting risk assessment to determine if the outbreak is a potential public health emergency of international concern, and maintaining and intensifying surveillance. All of these can be done in different orders. It doesn't follow this sequence and can actually be carried out steps simultaneously. So now we'll look at this first step, which is establishing the existence of an outbreak. So we need to verify the reported information by considering the following factors. Source of information, how reliable is the source of the rumor? Is the report from a health facility? And we also need to consider the severity of the reported illness and use standard case definition for reporting. So, for example, the number of reported cases and deaths. And ask ourselves if an outbreak is actually occurring. Could it be a true outbreak, or could it be just a situation where we have sporadic and unrelated cases of the same disease? And we need to review the data received and determine whether the observed number of cases exceeds the expected number, and conduct preliminary data analysis and collect additional data over the phone if necessary. So how do we determine if we have more cases than expected? For notifiable diseases, we could use the alert or epidemic threshold. So if the epidemic threshold is reached or crossed, then an outbreak is established. And we can also compare the number of current reports with previous weeks with the same time period or season in previous years using the weekly or monthly reports. And so for non-notifiable diseases, we could check hospital admission and discharge records and use data from neighboring areas or call local healthcare providers. We need to conduct an investigation when local health department receives a report of suspected outbreak due to immediate notifiable disease, and if there is an unusual increase in the number of cases or deaths during routine analysis of data, and if the alerts or epidemic thresholds have been reached for specific priority diseases, and if communities or social media reports rumors of deaths or large number of cases not being seen in the health facilities, or if there is a cluster of illnesses or deaths of unknown cause. All these are reasons for an investigation to be initiated. Preparing for field work. The public health emergency rapid response team has to be mobilized. This team is multidisciplinary, made up of a coordination team leader, epidemiologist, surveillance officer, clinician, lab scientist, communication experts, and veterinary officer or environmental health officer, depending on the kind of disease you are dealing with. And each member has to be trained. And of course, the protection of the members using personal protective equipment and other universal precautions have to be ensured. And then the terms of reference of this rapid response team must be defined. The objectives of the investigations and timelines of their work, the specified tasks or roles of each member, and the decision on where the investigation will take place. All these have to be well specified. And then preparing for fieldwork also entails gathering scientific knowledge. So we could review the literature for information about suspected disease, consult experts in the field, gather sample questionnaires, ensure standard methods relevant to the disease being investigated, such as collecting the correct laboratory specimen. And then we have to define supervision and communication lines. So there's need to make a communication plan and define who will report to whom, how information will flow within the rapid response team and between the local level and other levels. And also state methods and frequency for communicating during the outbreak. It could be daily updates by radio communication, in use of mobile phones or emails or conference calls. And they need to define the lines of authority and roles of each staff on the rapid response team, and define the role of non-health workers and how they should be supervised, and put procedures in place for communicating with community and key partners. There's also the need to decide where the investigation will take place. And so we have to review the information known about the suspected outbreak, for example, the mode of transmission and the risk factors, and use the information to define geographical boundaries and target population for conducting the investigation. This investigation should begin in the most affected place. And the required authorizations also have to be obtained. So authorization letters, clearances, and ethical forms and permissions required to do the investigation have to be gotten, and need to obtain agreements with local persons of influence in the community, especially for rural areas and among ethnic minorities. And we need to know who to contact when the team arrives. And they also need to finalize the forms and methods for collecting and analyzing data and specimens. So if the disease is known, and we can use standard case investigation forms and line listing forms, contact listing and tracing forms, and standard laboratory protocols. But if the disease is unknown, then we might have to develop new questionnaire to collect information on demography, signs and symptoms, and risk factors and others. So of course, they have to gather supplies for collecting laboratory specimens. And so the team has to look at disease-specific program guidelines and talk to laboratory specialists or the reference laboratory to find out specific requirements for laboratory supplies and for proper collection, storage, transportation of relevant specimens. Of course, if the lab kits are not readily available, there's a need to look elsewhere for them and ensure that health staff have access to and know how to use the required personal protective equipment. The next step is to verify and confirm the diagnosis. We need to review clinical history and epidemiology, such as examining patients and their records to confirm that their signs and symptoms meet the case definition. And need to meet attending physicians and other healthcare providers, collect laboratory specimens and obtain results to confirm the diagnosis. And so lab tests should be consistent with the clinical findings. Next step is to define a case and search for additional cases. We need to define a case using a standard case definition. And a case definition is a standard set of criteria for deciding whether an individual should be classified as having the health condition of interest. It includes clinical criteria and restrictions by time, place, and person, and it must be applied consistently and without bias to all persons under investigation. So if it is a new disease not listed among reportable diseases already under surveillance, and then there will be needs to develop an operational case definition. So earlier in an investigation, you may use a loose case definition because it is better to collect more than necessary, so you don't need to make repeat visits to the site. And later on, the investigation progresses, when hypotheses are sharpened, investigators may tighten case definition. So we use the case definition to search for suspected cases and deaths in the health facility records, and to search for suspected cases, deaths, and contact persons in the community. We use the case definition to isolate cases if needed and institute treatment. So isolation is a critical step in limiting spread of diseases during an outbreak and keeping healthcare facilities open and healthcare workers available. So we need to develop a line list and record information about additional cases. The next step is analyzing data and generating hypotheses. So after collection of data, we need to characterize the outbreak by time, which entails drawing an epidemic curve to determine the course of the outbreak, and then analyzing the data by place, such as plotting the cases on a spot map. Also analyzing by person, which would involve making tables with most relevant variables and calculating the case fatality rates and calculating the attack rates and all that. And so the team should update and analyze data daily for any changes in ideas regarding the causes of the outbreak, and interpret the data analysis, interpret the time analysis and results, and draw conclusions about when exposure to the agent that caused the illness occurred, the source of the infection, and related incubation periods. And so we need to observe carefully the epidemic curve because it tells us a lot about the kind of epidemic that we are dealing with. If the curve suddenly increases to develop a steep upslope and then descends rapidly, then exposure to causal agents was over a period of time and indicates a single exposure common source epidemic, or what is known as a point source epidemic. If the shape of the epidemic curve is a plateau, it means there was exposure to the common source over a long period of time, and this would suggest a continuous exposure common source epidemic. If the illness resulted from person-to-person transmission, that is, if we are dealing with a propagated epidemic, the curve will have progressively taller peaks separated by periods of incubation, as you can see on this graph. Yeah, so it's also important to interpret the place analysis results using the map that you've plotted. And the map can be used to describe the geographic extent of the problem and identify high-risk areas. And so we can also identify and describe any clusters or patterns of transmission or exposure. And depending on the organism that is causing this outbreak, the map too can specify the proximity of the cases to likely sources of infection. And so interpreting the person analysis results leads to information of person analysis being used for planning the outbreak response, and helps describe the high-risk groups for transmission of the disease. For example, if influenza cases were occurring in persons less than 15 years during an outbreak, then the vaccination response should target children less than 15 years of age. So with all the time, place, and person analysis that are done, we'll then be in a good position to make conclusions about the outbreak by answering questions such as what was the causal agent of the outbreak, what was the cause of the infection or the outbreak, where is the outbreak occurring, what was the transmission pattern, where is it moving towards, and who are the persons at risk of becoming ill, what control measures were implemented, and to what effect. So with this, we'll now be in a position to generate hypotheses, and because we now know a lot about the disease, about the reservoir, the mode of transmission, the common vehicles, and the known risk factors. So we use descriptive epidemiology like the epidemic curve and the spot map and the tables to generate hypotheses about the causes of the observed patterns and the factors that increase the risk of the outbreak. The next step is to test and refine your hypothesis with analytical study. So based on descriptive epidemiology and situation, appropriate study design is selected, and analytical study designs that can be used to test this hypothesis we have generated include case control studies, cohort studies, experimental design. And so we then draw conclusions from the study and refine the hypothesis we've earlier made as needed. Another crucial step is that of implementing control measures. And we need to do this as soon as possible, and we need to conduct an immediate response, isolate and treat cases as necessary. And these may be aimed at the agent, the source of the infection, or the reservoir, including controlling the source of pathogen, interrupting the transmission, or modifying the host response. So controlling the source of the pathogen could involve removing the source of contamination, removing persons from exposure, inactivating or neutralizing the pathogens, as is the case when we chlorinate water, or isolating and treating infected persons. Interrupting transmission could be achieved by interrupting environmental transmission, controlling vector transmission, and improving personal hygiene. And we can modify the host response by immunizing susceptible persons in the community in the case of vaccine-preventable disease outbreaks, such as measles. And we can also use chemoprophylaxis. The next step is that of reporting and disseminating our findings. And the report should be written promptly and on site by the rapid response team. The report should be disseminated immediately to the health facilities and the community where the outbreak occurred, as well as to the local health department, state and national health authorities, and the World Health Organization, as the case may be. Situation reports of the given outbreak should be prepared and shared with relevant stakeholders too. Another step is that of conducting risk assessments to determine if the outbreak is a potential public health emergency of international concern. So the designated investigation team should initiate risk assessment as soon as possible to address the following questions. Is the public health impact of these events grave? Is it serious? Is the event unusual or unexpected? Is there a significant risk of international spread? Is there a significant risk of restrictions to international travel or trade? These are some of the questions, criteria that define what a public health emergency of international concern. So these questions will help us determine if that is what we have at hand. We also need to maintain and intensify surveillance as part of the response to an outbreak. And national and state levels should maintain contact with the local level for daily updates on the cases, the deaths, and the number of people admitted, the number discharged, the areas affected, and so on, until the end of the epidemic. And they need to ensure that the usual reporting system and tools are used to enhance surveillance of disease. And there's need to avoid parallel reporting, which can lead to confusion on the progress of the outbreak. There's also need to periodically report on progress of response and prepare daily situation reports, update the line list, conduct data analysis by time, person, and place, monitor effectiveness of the outbreak response activities, share information, and also plan for joint surveillance and response activities with neighboring districts or regions, intensify surveillance with neighboring districts to ensure the outbreak does not spill over to other locations. Yeah, so to recap, the steps in outbreak investigation and response, and like we've stated, mustn't follow this sequence, but they include establishing the extent of an outbreak, preparing for field work, confirming and verifying the diagnosis, defining the case and searching for additional cases, analyzing the data and generating hypotheses, testing and refining the hypothesis with analytical study, implementing control measures, writing a report and disseminating the findings, conducting a risk assessment to rule out the occurrence of a public health emergency of international concern, and then maintaining and intensifying surveillance. Thank you very much. See you in Unit 3.